So was there a specific event in your life that made you, was it just because you're a pediatrician, or was there an event in your life that made you want to become an IBCLC?
It was the birth of my son, my oldest. So he turns 4 in June. Happy to have
Oh my
babies.
gosh, they're
Yeah.
twinsies.
So he was born and had issues almost immediately with nursing. And he had we just really struggled like getting a good latch, getting him to transfer, all of these things. And so I had joined a Facebook group called Dr. Milk, which is an acronym, doctor mothers interested in lactation knowledge. And there's like 30,000 physicians that are all breastfeeding in this group.
Oh, that's
It's all
amazing.
over the world. And so I was going on there and I was reading, I'm like, well, how do I get this kid to latch? Like, what am I doing wrong? Because the lactation consultant had looked at it and she was like, oh, that latch looks great. I was like, well, good. And it didn't hurt. So everyone just assumed everything was fine, but he actually wasn't transferring. And we went to a lactation consultant and, she said, oh yeah, we're like, everything looks good. And then we did a weighted feed and he was transferring like less than half an ounce. And at this point, he was 2 weeks old and he should have been obviously transferring more than that. And so then she said, oh, I think he has what's called a posterior tongue tie. And, had never heard of that. So I started searching this group and I was like, has this ever been talked about before? And people were like, yes, this is a real thing. It's not recognized as a diagnosis by the American Academy of Pediatrics or the ENT community. They don't
Yeah.
recognize posterior tongue tie as a diagnosis. But based on what these breastfeeding medicine physicians who have been doing this for 20 plus years said, yes, it absolutely is a real thing. We see improvement with revision, and that I like posted our whole story, and they said yes, I would obviously this isn't medical advice, but this is other physicians, and they had all said that yes, that this sounds very similar to patients they'd seen, and revision helps. We got him revised, and his weight took off.
Oh, wow.
He jumped from the 3rd percentile back up to the 50th percentile, and he nursed till I got pregnant with my twins. So that alone made me realize that, yes, we're pediatricians, and yes, we are the experts in children, but this is not directly something we're not really taught any sort of lactation knowledge. We're not really taught about breastfeeding other than the basics. And a lot of the female pediatricians who are mothers and then choose to breastfeed, they can provide knowledge and experience based on their own personal experience, but it's not like evidence-based medicine.
Right.
So that's what I wanted to do. I was like, okay, who do you go to first? Because once again, our healthcare system, you see your OB one time and that's at 6 weeks.
Yeah.
But you see your pediatrician like 5 times before then. So we're usually like the gatekeeper of any sort of breastfeeding problems. And it just seems silly to me that I'm like, I could help you. Why don't I just get this knowledge so I can help you? So I started doing, they're called IABLE, the International Association of Breastfeeding and Lactation Education, I think is what it stands for. And it's ran by Dr. Anna Glash, who's a breastfeeding medicine physician and one of the originals. She's been doing this for so long and learned all about the science and the evidence behind breastfeeding medicine, and how to implement it as a pediatrician. And just as I've practiced, just figuring out what I see in my practice and what works, and developing a network of people that I can refer to and have assistance with has been really great. But yeah, so it all stemmed from my oldest and our breastfeeding journey.
I I love that story. Thank you for sharing it. I'm so sorry you had to go through that, but I am so thankful that you're doing what you're doing. And
Yeah,
I know, like, I would have loved to have met you when I was dealing with the same situation with my son. Oh my
yeah,
goodness. Like, the fact that you can treat the child and the mom is incredible. I
mm,
think it's so strange. Like you mentioned, you don't go back and really see your OB. There's not. What does the mom do? Who is the mom supposed
yeah.
to go to
The
for
mom
medical
the moms
advice?
don't really have anybody.
Yeah. That's a
It's
shame.
Yeah. So I do a lot of screening for moms, and I've developed a really, really what I think is fantastic network of maternal mental health specialists,
That's great.
of people that I can, because I do think breastfeeding, yes, reduces the goodness, of postpartum anxiety and depression, but I do think it's also a big source of postpartum anxiety and depression. Uh,
Yes, speaking for myself, I agree.
and I
Definitely heard it.
yeah, a lot of moms, it's, I mean, you always think like my one job is to make you grow and to feed
Right.
you, make sure you're not hungry. And if that isn't going well, especially in those first 2 weeks when your hormones are just everywhere, it's really hard. So I really tightly screen, and I get on it probably pretty soon of like, you need to you need to speak to a therapist. And I've been able to find some really, really great resources, in like an emergency, or if I need you acutely, or now that I've found Leva, like I think you need to have something daily, or like your mind needs to be a little bit calmer, and you need to be able to take that time for yourself.
That's amazing.